Thanks for having us. I'm Sarah Long, and I'm the Family Treatment Program Manager at Helen Ross McNabb. And our agency receives United Way funding for a lot of our programs, but I wanted to share a little bit about one of my programs that I manage, just to kind of give you an idea of how United Way helps us. I'm going to talk to you this morning about Great Starts. Great Starts is a family-centered treatment program. It started in 1990, and it started because women needed a place to go to recover from addiction, but they shouldn't always have to decide whether they want to get help for addiction and parent. And so what's really special about Great Starts is that women come to us and they live on site with their children while they're getting help. The average mom that comes to Great Starts is pregnant. Most of them have older children that are living in foster care or with other family members, and they come because they really don't want to have to be separated from their baby. They want a shot to parent. They're experiencing problems with substance abuse. Most of them are addicted to prescription pain medication. And the majority of the moms have had really difficult lives before they've come to us. Most of them have experienced child maltreatment, domestic violence, and other forms of trauma. And so they learned really early on to numb their problems with drugs and developed an addiction that's causing them to have their custody threatened. And so they come to us, and the moms get a whole range of services. We help them figure out how they're going to stay sober, how they're going to parent, how they can be mentally healthy. We help them find jobs and housing when they leave. But we also provide a lot of services for children. We have an infant mental health specialist who makes sure that the baby and the mom are bonded and they're functioning well as a family. We do developmental assessments on the children because prenatal substance exposure puts these babies at risk for falling off track developmentally. Without United Way funding and without Great Starts, these children would probably end up in foster care and in state's custody. And so Great Starts gives them a place to come and learn to be sober and function as a family without needing foster care. And without United Way fundings, we wouldn't be able to do it. United Way funds everything from helping us to keep up our facility and our staff team so that we can provide these services to the families in our community. Thank you.
Awesome. That's really great.
Good morning, my name is Kristen Bradley. I'm the over Prevention Early Intervention Services at the Helen Ross McNabb Center. And I'm going to talk to you today about our therapeutic preschool program. It's an intensive outpatient program, at Helen Ross McNabb that serves children ages 4 to 6. We call it therapeutic preschool because if you say to a 4-year-old that they're going to an intensive outpatient program, that's scary. So we try to keep it very natural to their natural environment, what they're familiar with. But the population that we serve are children who have experienced any form of trauma. So that can be anyone from abuse, neglect, witnessing domestic violence, drug trafficking, experiencing a natural disaster, anything that really causes that sense of fear and trauma in a child. They come to our center 3 times a week for 3 hours, and they're with us for 10 weeks altogether. Our program is set up very much like a preschool, so they have centers, they have transitions, they do art, they have activities. However, our curriculum is very focused on giving them the tools to help cope through that stress of trauma. So we talk a lot about how do they identify their emotions and teaching them how to put words with their emotions, which oftentimes will decrease the tantrums, will decrease the aggressions, will help kids better communicate. We will teach them who their safe adult is, where their safe place is. So when they feel like they're in danger, where do they go? What do they need to do? We teach how to call 911. What do you tell 911? Most 4-year-olds know what 911 is, but they don't know what to tell them. We bring people in from the community, like firefighters and police officers, because oftentimes that can be associated with their trauma. By the end of treatment, our goal is really to give the kids a toolbox. So regardless of the trauma that they've been through, they go through the whole curriculum because at 4, 5, and 6, they're still going to experience a lot of adversity growing up, and we know that. So we want to give them the toolbox so they can cope through those stressors as they get older. Usually at the end of program, a lot of our kids, when we ask them, what did you learn at preschool? What did you like about preschool? They'll tell us that they were able to make friends. Oftentimes these kids are very aggressive. They're very defiant, or they're on the other end of the spectrum and very shy and withdrawn. And so that tells us that they've become confident, that their fear has decreased, they've got the language to make friends. At Helen Ross McNabb Center, our mission is to improve the lives of the people we serve. And United Way allows us to do that. We have 31 programs at our center that receives United Way funding. Specifically for therapeutic preschool, United Way allows us to never turn a child away. On many of our population, they may not have the ability to pay. They may have transportation barriers, they may have education barriers, whatever those barriers are. What United Way allows us to do is really break down those barriers for services so that everybody that comes to our center that needs a mental health service can get that service. And then even specifically with therapeutic preschool, it's a prevention and intervention program because one, we're treating the immediate trauma. But in addition to that, what we know is trauma affects the brain completely. And if we don't get in there and decrease those trauma symptoms early, it can really affect the brain long term and increase the risk of more mental illness. They will perform poorly and academically. They have a hard time with social skills. So our goal is really to get in there and also do a lot of prevention as well. We have a big United Way campaign at Helen Ross McNabb Center as well because we believe in it. It gives us the ability to really serve our community. And United Way does that for a lot of agencies in the Knoxville area and other areas that United Way is in as well. So I want to encourage you guys to donate. Even $1, if everybody that we ever talk to donated $1, I mean, that would make such a huge impact for our community as a whole. So thank you for having us.